Postpartum Depression by Kaylee Snyder. Sometimes it can be confused with baby blues. Here I've attached a picture of my daughter and her baby blue eyes, as well as being confused with postpartum psychosis. Here's Emerson having some memorable tantrums, which sometimes I feel like is psychosis. Just kidding. Here are some differences between baby blues, postpartum psychosis, and postpartum depression. In baby blues, it fades, it's mild, you have an occasional weepiness or crying, you have some stress, anxiety, trouble sleeping, and mood swings. But all of these things are super mild. It's not a severe case, and it goes away in max 2 weeks, starts 1 to 2 days, it's not very long. Postpartum psychosis is delusions and hallucinations. It's sudden, dangerous, it's treatable, and fatal. Fatal because they're hallucinating of killing themselves or killing their baby. In this picture you see a woman who looks maybe a little disheveled. She has her hands in her hair. Her appearance might be a little off than what it usually is. She looks withdrawn from her child. The child's just sitting on the couch. Mother's not helping, mother's not taking care of it. It's a good indication that this woman could possibly have the baby blues or postpartum depression or even postpartum psychosis. So, what is postpartum depression? In my maternal child book, the definition states, non-psychotic depressive illness that is usually manifested within 2 to 4 weeks after delivery and affects 10 to 20% of postpartum women in the U.S. According to the D5M5, postpartum depression is classified as bipolar disorder or depression with peripartum onset. Then they need to meet 5 of these symptoms, and the symptoms are listed here, which are depressed mood, diminished pleasure in all or most activities, significant weight loss or gain, insomnia, hypersomnia, which is trouble sleeping or too much sleeping, loss of energy and fatigue, feeling of worthlessness or guilt, diminished ability to think, recurrent thoughts of death. If you have 5 of these things, then you could be possibly diagnosed with postpartum depression. Manifestation of this disease include depressed mood or severe mood swings, excessive crying, difficulty bonding, withdraw from the baby, from your family, just withdraw in general, loss of appetite, insomnia, anhedonia, anergyria, feeling like you're a bad mom because all of these symptoms are causing you to not be able to bond with your baby and not being able to take care of your baby. And that can lead people to feel like they're worthless, or they can feel shame or guilty for not being able to do these things. They don't have any concentration, severe anxiety, panic attacks, thoughts of harming self or the baby, and recurrent thoughts of death or suicide. Here's another picture. It's super important to know that postpartum depression is a form of depression, and it's an illness, it's not a choice. To keep the stigmatism away and just focus on treating this person and treating them like they're a human and that they're not crazy, because they're not. It's an illness. So how do you know if you have postpartum depression? You're obviously not a doctor or a psychiatrist, so you can't use the D5M5 to diagnose yourself or just diagnose yourself in general. Well, you need to make an appointment if your symptoms don't fade, they get worse, it becomes difficult to care for your baby, you cannot complete everyday tasks that you once did, and you have thoughts of harming yourself or harming your child. Once you get an appointment with your family practitioner or your primary doctor or your psychiatrist, they'll probably do a depression screening, which is a 10-question test that evaluates a person's depression and how severe it is. The doctor then can determine whether it's the baby blues, postpartum depression, or postpartum psychosis. If there's nothing that shows in here, then they'll do blood tests to see if your thyroid is contributing to your signs and symptoms. Treatment depends on how severe the case is. If you have the baby blues, they probably most likely aren't going to treat you because it's going to fade away. If you have postpartum depression, they could use psychotherapy, antidepressants, possibly mood stabilizers, maybe a combination of psychotherapy and antidepressants. For postpartum psychosis, they may use psychotherapy, antidepressants, mood stabilizers, and even antipsychotics. Psychotherapy is just talking with a psychiatrist, and that's just to help you with coping and solve problems and set goals and respond in a positive way to all these symptoms that you're having with the depression, with the mood swings and the crying and everything that goes with postpartum depression. And here we have a picture of Emerson. It looks like she's probably set a goal of eating some ice cream and she's accomplished it, and now she's happy and has her hands up in the air. One way to treat the postpartum depression is the antidepressants, and a few of those include Lexapro, Zoloft, Zyban, and then the action of these is to increase the amount of serotonin in the brain, and that works by inhibiting the serotonin receptors to receive the serotonin. And then some side effects of these is nausea and vomiting, increased appetite and weight gain, ED, fatigue and drowsiness, insomnia, dry mouth, blurred vision, and constipation. Another way to treat the postpartum depression is mood stabilizers. This is for severe cases, and some drugs for this is Lamictal, Depakote, and Lithobud, which is lithium. When I was doing my research, I noticed that it was mostly people that couldn't tolerate the antidepressants. So it's more for postpartum psychosis, but some people with postpartum depression are also receiving the mood stabilizers. So what's this person's quality of life going to be like? It's probably going to be worsening because they just had a baby and they can't take care of it because of the depression, and that's going to make them feel worthless or guilty, and they're going to be scared about it because they don't know what to do. There's such a stigma in this disease that they don't know where to turn to. Some nursing interventions are, you can show that there's hope and don't minimize their feelings. Just let them know that this is okay. And help identify sources for emotional support, whether that be support groups, husband, friends, whoever. And then help mother meet her own needs. She's so worried about taking care of the baby that she might not be taking care of herself. And refer her to a psychiatrist or to whoever she needs to be referred to. Here's a list of my resources. I got most of my information from Mayo Clinic, some of it from the Introduction to Maternity and Pediatric Nursing, some more from the Essentials of Psychiatric Mental Health and Nursing, and my med book.